The patient is in ICU, no visitors. He's on a ventilator. You may have heard people speak in hushed tones about the high-tech and secluded hospital zone called the ICU or CCU, where your loved one is being cared for with limited visiting hours and all kinds of instruments and beats and clicks sounding like a well-synchronized electronic orchestra. The ICU is a unit in the hospital where talented and dedicated team of doctors and nurses battle day and night to help critically ill patients recover. In this episode of Let's Talk Health, let's take a walk through our ICU department and meet our health experts who help the patients win the war against life-threatening illness.
It might be late in the evening in this hospital facility in Chennai. But the ICU of the hospital is a demanding place. A young patient is getting admitted to the intensive care unit for immediate medical intervention. The ICU specialists have teamed up to stabilize and treat the patient. This is how a critical care unit or an ICU of a hospital operates. But it is different from an emergency room.
Emergency medicine is the first contact for patients with any acute issues. For example, one has a chest pain. The chest pain could be something benign, like just a little bit of muscle pain from pulling a muscle, lifting a heavy weight, or it could be a serious heart attack. So the first contact would be an emergency medicine. Both probably trouble the patient enough that he had to come to the emergency room in the middle of the night, and both need treatment. But one is life-threatening, the other is not. Critical care deals very clearly, only with life-threatening diseases. For example, I wouldn't be dealing with a fracture as long as that fracture was not a threat to the patient's life. Yes, it is an inconvenience, it is going to cause a lot of distress, pain, but it's not a life-threatening issue, and it can be handled outside an intensive care unit in a regular ward and an orthopedic ward. On the other hand, somebody who has an acute chest pain and a massive heart attack needs to be taken care in the ICU because they have a life-threatening problem.
The critical care team is a group of trained medical professionals who provide consistent care to seriously ill patients and work towards the best possible outcome.
So a trainee during the 2 years formally goes through training in various ICUs, each for maybe at least a month or month and a half, learning the nuances that are necessary to handle patients with those specific problems. We also put the trainees through what we call simulation training, like how pilots have a simulator to learn how to fly, how to land, how to deal with emergencies. Now, in critical care, it's essentially the same analogy because one, emergencies can happen anytime. Two, they may be rare, and so you may not get enough opportunities to keep practicing certain skills within the 2-year training program. It can happen any time of the day.
Nutrition management in the intensive care unit is a vital part of treatment. The critical care specialists work very closely with the nutritionist in providing the correct amount and type of nutrition to the critically ill patients. Once the condition of the patient improves, the subsequent step is to help them restore mobility around the joints. The physiotherapists in the ICU are trained to devise exercises that are tailored to a patient's needs to help them lessen the adverse effects of prolonged bed rest. The most important role of an ICU department is to facilitate communication between the specialist doctors and the family members of the patients. The critical care specialists become an integral part to the decision-making process of the patient.
We do have social workers who interact with families every day, trying to get a sense of what they are going through and trying to help them in whatever way we can, and try to have several sessions one-on-one with the patient's family members so that we can hold their hands and try to give them whatever support we can in those kinds of situations.
In this episode, we look at stories of two young patients who survived life-threatening health complications after they were treated successfully in the intensive care unit. It was a warm, sunny afternoon. Zikya had to pick up a friend on his way to college. He took his father's bike but forgot to carry a helmet along. It was a left turn that turned into a deadly maneuver for this 19-year-old.
When I reached the place where it happens, so my boy without shirt, blood vomit came. One of the senior doctor told, sir, the son's condition is very bad. He is about to die.
Zikya's father serves as a pastor in a church. It was upon the advice of visitors that he shifted his son from the local hospital to another healthcare provider in the city. But the trickiest situation for the father was to give consent for his son's major brain surgery.
I started crying, full of tears. So I took my kerchief and doing like this. Oh Lord, please help me, please help me. Please help me, Lord. I was crying. My hands were shivering. I saw my wife's face, my sister and my mother-in-law, father-in-law, everyone. I'm looking. They said, what is your opinion? Whether you are accepting or not? The doctors are, sir, don't waste my time. We have to take the boy to operation theatre. Please put it very soon. Then I just pray to God and trust in God. I put D. Emmanuel. Okay, sir. Please take my son to operation theatre.
He was completely unresponsive, almost in a coma, and he had continuous seizures by the time he reached our facility here. So to control the seizures, we had to first give him medicine, stabilize him, put him on a ventilator so that we could support his breathing with all the medications. Immediate decisions had to be taken to support the brain.
The skull is made of bone and serves as a hard protective covering for the brain. Inside the skull, the normal brain function requires a delicate balance of pressure between the blood and blood vessels. The cerebrospinal fluid that surrounds the brain and the brain tissues. This is called normal intracranial pressure. Due to a massive head injury, this intracranial pressure increases, leading to swelling and changing the shape of the brain inside the skull.
Procedure decompressive craniectomy. Decompressive is easy. You want to decompress something. Here the brain is being compressed by a lot of pressure because of the swelling and the blood clot. As you can imagine, skull is a very rigid box. It doesn't expand, it doesn't allow room for expansion. Therefore, when there is pressure in the brain, there is nowhere for the brain to go but to squeeze on itself. So a part of skull is basically taken out for two reasons. One, to take the blood out, and two, to allow the brain have some space so that it can expand into that open area so that the pressure in the brain is not above a certain level. The piece of skull that is taken out is usually handled in two ways. One, it can be kept in a fridge and kept safely so that when the patient gets better, the skull piece can be put back on the patient. The downside of that approach is, one, it can get missed, it can get switched between patients, errors in terms of labeling can happen, and third, when the patient gets better, he is forced to come back to your own hospital for the surgery. The more common way that it is dealt with is a small pouch is created in the fat of the abdominal wall, where this piece of skull is basically kept in that pocket and sutured along with the patient, so that one, there is no confusions about labeling and all that, and two, patient is free to go to maybe a nearby town where he's from to go and put this skull back to cover the hole.
After performing the procedure, the ICU ward continued to support Zekia's brain with medications for the constant seizures that he was experiencing. It was after a month of intensive care in the hospital that Zekia was discharged in a stable condition. Zekia is back to leading a normal life with his friends and family. The brain injury has healed completely, but there are a few problems that he has to cope with.
I can remember you now for 1 month or 1.5 months, 2 months, but about 3 months or 2 months itself, I will forget you and your voice. I can talk to you. Who are you? That kind of also I might talk that like you with you. But I'm recovering now by the grace of God, and then I'm recovering now.
He is improved remarkably to the point where he's completely independent at home, taking care of himself and working towards resuming his activity outside the house. It is not uncommon for people like Ezekiel to have a slight stutter in their thought process in terms of trying to comprehend and respond in the speed which a normal person does, and this is usually short-lived, and over a period of time they improve. He's at a point where he's pretty fluent, except that he has to have a few seconds of thought process prior to continuing.
Zekia's parents are happy beyond measure to have him back, and they pray that no parent should have to undergo such an ordeal.
My son did very great mistake. He did not wear helmet. My helmet was there in my home, but he didn't take the helmet. So number one. Then another thing is those who are driving the car also, they must go they follow the rules of the government and go carefully. Finally, I can say, at the age of 19 or 20 only, the parents should give the bike to their children. Before that, if they take means, these things may happen.
Zekia, a student of architecture, is about to resume his studies in a month's time. He spends his time honing his drawing skills at home, and on special days he accompanies his family to the church, where he is back to singing the prayers and playing the drums. We wish this budding architect a speedy recovery and the very best in life. In 2015, India faced its first ever dengue outbreak since 1996. In the national capital alone, the dengue menace reached an all-time high with thousands of patients testing positive.
What WHO says is like almost 50 lakh newly infected patients are detected every year. That is international statistics. In India, what we have is almost 50,000 patients are diagnosed every year. That is the 2012-2013 statistics. Every year, it is almost doubling. The number of patients are almost doubling. It started like 2007, 5,000, 6,000 new patients. Then it became 10,000 patients, 15,000 patients like that. And 2013, it is almost 50,000 new patients detected as dengue.
A first-year student of food science, Pavitra, was diagnosed with dengue in 2013. For a long time, she mistook the symptoms for a seasonal viral fever.
I had rashes in my lower leg, and I had few body pain. But then, I didn't go to the doctor because I wasn't sure that I didn't know that it would go to such a serious note.
Dengue fever is transmitted by the bite of Aedes aegypti mosquito. This mosquito becomes infected when it bites a person with dengue virus in the blood. It takes nearly 10 days for the dengue virus to incubate. The dengue-infected mosquito then bites another person and thus circulates the infection.
Dengue will start having more body ache and joint pain, severe body ache, severe joint pain. Because of this, dengue is also called as break-bone fever because the pain will be like breaking the bones. This happens in almost all the patients of dengue. Only few percentage, like 15 to 20% of the dengue patients progress to the next phase, where there will be leaky capillaries. In the blood, there is two components, fluid component and cell component. What happens in dengue is this fluid component starts leaking from the blood vessels and starts accumulating in the abdomen, in the lungs, in the body, everywhere. So that phase, the fluid accumulation phase starts. The patient will behave like a abdominal problem patient. They will have lung problem like they will behave. But actually this is just the fluid accumulation there. And then it slowly progresses to low platelets and patient will start showing signs of bleeding. Okay, this does not happen in all the patients. Let it be very clear. It's only in 15 to 20% of the patients dengue will progress to this stage. In this 15 to 20% where it progresses to fluid accumulations, low platelets, bleeding, in 4 to 5% of those patients will progress to what you call as multi-organ failure.
Without immediate medical intervention, Pavitra's condition had worsened. From a local hospital, she was shifted to another healthcare provider in the city where she was treated for multiple organ failure.
मल्टी ऑर्गन्स फेलियर होने में री-पिकअप होने में बहुत मुश्किल करके था, वापस से जीतेगा करके वो लेवल तक हमारा मन चला गया। ये हमारा वाइफ डेली आ रहेगा, ये हॉस्पिटल में के पास मंदिर है, उधर जाके टोटली प्रार्थना करते रहते हैं। हमारा वेल विशर सभी भी बहुत प्रार्थना करके आता है हॉस्पिटल में। मेरा मन बोलेगा ये वापस नहीं आएगा, वो लेवल में चला गया।
When we received her, she was unconscious. She was unconscious. Her liver functions were very bad. There is no specific treatment for dengue. So what we need to do is, whatever organ is involved, we need to support that organ. And viral diseases or self-limiting diseases, you just support the organ till it recovers. So she had fluid accumulation in the brain became tight, so she became unconscious. So we need to support that brain by just giving anti-edema measure. We give drugs to reduce the fluid accumulation in the brain and ventilate her. That itself slowly will settle the brain edema. Then she will improve, her consciousness will improve. Coming to the platelets, her platelet was very low. There is no magic treatment to improve the platelets. What we do is, if this low platelet is causing a bleeding, we give platelets. If it is not causing bleeding, we just observe it. In her case, she had some bleeding, so we gave platelets to keep the platelet count around 30,000-40,000. That's what we did. Coming to her liver problem, she had very bad liver symptoms. She went into what you call acute liver failure, okay, caused by dengue. The treatment for acute liver failure is, once again, to prevent further insult to the liver and support the liver by giving some supportive medications.
For Pavitra's mother, it was difficult to see her daughter lying unconscious on the hospital bed for several weeks. Her distress ended the day Pavitra recognized her and called her Mummy.
உள்ளே போனேன்னா நான் மெல்ல கண்ணை திறந்து பார்த்துட்டு அப்படி லைட்டாக ஸ்மைல் பண்ணான். வாயில் டியூபு, இங்கே டியூபு. அவள் சிரிக்கிறாளா அலறாளான்னு தெரியல எனக்கு. அப்படி என்னை பார்த்துட்டு அப்படி ஐ வாண்ட் டு ரைட்டுன்ற மாதிரி சைன் பண்ணான். அவளுக்கு பேப்பர் பென்னு கொடுத்து அவளால் பேச முடியல. மம்மி யூ ஆர் லுக்கிங் லைக் ஜோக்கர்னு எனக்கு எழுதினேன், ஃபஸ்ட்டு எழுதுனது. ஏன்னா அந்த ட்ரெஸ் எல்லாம் பண்ணிட்டு போனேன். நான் சிசியூவில் போகும்போது அந்த கோட்டெல்லாம் போட்டு போகணும், க்ளவுஸ் கோட்டெல்லாம்.
அப்படி ஒரு ஹாப்பினஸ் எனக்கு.
As luck would have it, the day of discharge from the hospital coincided with Pavitra's 16th birthday. It was a joyous celebration for not just her family members but also the hospital staff.
I was actually sad in the beginning, day before my birthday, because I knew that my friends wouldn't be there, my parents also wouldn't be there more than 15-20 minutes. So I was actually really upset. I didn't want my birthday to happen actually in the hospital. And then it turned out to be the one memorable birthday ever.
So we kept her in the ward for next 2 weeks. And slowly with the physiotherapy and other supportive care, she improved and weaned the tracheostomy. Then only she went home. Once she went home, she never had any problem.
Pavitra is making the most of her good health by ticking things off her to-do list. These days she is learning to play the violin, engrossed with her music, she has a newfound appreciation for life.
Hello everybody, I'm here to give you an update on Miss Pavitra, who suffered from dengue. Thankfully she was diagnosed early, she now has no further complications and is leading a completely healthy life. Her vitals are back to normal, she's going back to college, and she's basically enjoying life just like a normal teenage girl would. Mr. Ezekiel is also, post a very traumatic accident, slowly but surely getting back to very normal life. He's on his monthly follow-up with his neurophysicians and is planning on joining college in the coming year. Folks, critical care requires precise coordination and a multidisciplinary teamwork that extends across a group of consultants across specialties. It requires specially trained nurses, technicians and staff. It is quite literally the difference between life and death. Till we meet again next week on Let's Talk Health, goodbye for now.